Hello everybody. You all will agree with me when I say pregnancy is nothing but just a physiological change where a lot of changes keep happening with the immunology and the cardiopulmonology activity that keeps happening. So during this physiological change, we have not seen that this COVID infects the pregnant women any more than the general population. But it is always better to know, prepare and protect yourself, which is very important. So how do we prepare ourselves during this pregnancy in these times of COVID? You have to remember that this is a new pandemic, and here the novel coronavirus is detected newly in the human phase of life. So a lot of research is going on for the same, and then new data are coming up every day. So it is not proven that the pregnant mother gets infected more. But let us still stay safe. But how do we stay safe during this period? Make sure that you wash your hands regularly, and every time you wash your hands, use water and soap adequately for 20 seconds, which is very important. And while you wash your hands, make sure you cover both the surfaces of your hands. Make sure between your fingers you clean, and then do not forget your thumbs, and also the tip of the fingers needs to be covered, as well as the wrist also have to be washed, and all these things to be done with 20 seconds. Make sure you start using hand sanitizers before you touch any surface and when you're going out of home and coming back from home. Try and make sure that you do not come in contact with many people, and then make sure where every time that you come out of the house you use a mask, and also follow your doctors when you're supposed to be meeting them. Minimum of 3 to 4 visits, one for your NT scan, which is between 11 and 13 weeks, that's your third month. Fifth month again for your anomaly scan, and term at around 36 weeks it is mandatory to meet your doctor. And when you go to the hospital, make sure you wear a mask and use hand sanitizers adequately, and maintain social distancing between the two people, where a minimum of a 6 feet distance have to be maintained for social distancing. And if you are well prepared, it is always sure that you will be going home healthy with a bundle of joy, and which is very important. Follow your doctor's instructions. Make sure you connect through them either through the phone or through the video consultations. We here at Narayana is available for you through the video consultations that can be done for you. And once you have delivered, we are geared up to receive you. Make sure that we send you home healthy and taken care of you during the process of delivery and post-delivery as well, to make sure you are happy and you're doing well. And once you have delivered, you can definitely feed your baby, because breast milk is free from COVID. And hence you can be with your baby. In case unfortunately you're diagnosed to have positive, then you have to make sure that you wear a mask, cover your mouth, do not sneeze and cough on your baby, and then you can express the milk and make sure that somebody else feeds the baby. And in order to make yourself free, make sure that you do not touch your face frequently. And like I mentioned, please wear a mask. And whenever you're sneezing, please make sure you're coughing. You follow the etiquettes where you either sneeze or cough into your elbow or into your arm, and not directly on the open air. And you cover using a tissue where this tissue needs to be discarded, which is very important. So stay safe, stay happy, stay at home, and come out only when required. I advise you to also remember, please do not self-medicate. Do not try to subside your symptoms by taking medications. It's really going to put you into trouble by self-medicating. Reach out to your doctors when you're suffering with symptoms. I also request the family members to support this pregnant lady, so that she doesn't have to go through any anxiety and depression, and all of you can sail together and stay happy. So take care of yourself, and wishing you a happy pregnancy. Thank you.